Hi, I'm Zach.
And I'm Alex.
And our project is called Holding Your Heart in Your Hand. More specifically, we're trying to replicate human organs on a mechanical level using 3D printing.
So every year, over 251,000 patients die during or shortly after surgery due to medical error. And the reason this mortality rate is so high is because surgeons just don't have adequate means of preoperative planning, as current means rely heavily on three-dimensional imaging on two-dimensional mediums, such as scans on a computer screen. And not that far ahead are the hard plastic 3D printed models that you can't actually operate on. And on the flip side, you have the animal organ models, which you can operate on, but they're not patient-specific, and they're wasteful and it's expensive and it's harmful for the animals.
So we develop our engineering goals based off of those limitations. We want to create a model that is patient-specific and mechanically accurate, so that it creates a better tool for the surgeon to practice, and most importantly, cost-effective, so it does not add to the medical bills of the patients.
So in order to create such a model, we needed to look for the proper ink material. So we looked to a previous study which compared silicone molding materials and their mechanical properties to that of real aortic tissue. And what was found is that the commercially available, actually Hollywood special effects molding material, EcoFlex 00-10, most closely mimicked the mechanical traits of real aortic tissue. However, as it comes, this is a gel. So it's not good for 3D printing, and so we need to alter its physical traits with chemical additives in order to make it suitable for 3D printing.
After we found the right material, we also want to develop a process in which it will provide the model to the hospital, to the surgeon as quickly as possible. This is our process. We first will receive the CMR scan from the hospital of the patient's organ. Then we section out the specific part of the heart, in our case the aortic valve, and you go through a post-process in which some of the holes are filled and the edge are smooth. Then the finalized model will put into a software called Slicer. The Slicer will look at the model along with a variety of parameters and develop a toolpath for the 3D printer to follow. While the program is looking at the model, an ink mixture will be developed.
So through developing these ink formulations, we really use a trial and error approach. Now we would add a certain amount of one additive and a certain amount of other additive, and we would print it and see what we liked and what we didn't like, and if the print turned out well or if it didn't turn out well. And through many trials, we were able to really get this formulation down to what it needed to be in order to successfully 3D print a mechanically accurate, realistic aortic valve model.
Though we did have some limitations, such as some environmental factors such as humidity and temperature, where we could not control, that might have affected the curing properties of the ink mixture. We believe there's a big future for the potential of our project, in that the processes in which we developed to look for mechanically accurate ink mixtures and how to 3D print with them can stretch us far beyond the heart into other parts of the human body or even animal bodies.
So in the future, we hope to broaden our process and our models to other animal organs and human organs for both resident students in high school classrooms and college classrooms alike to practice on cheap and effective realistic organ models, and supply a patient-specific organ model for surgeons to practice on prior to surgery.